Today I'm going to talk about the cranial nerves. If you get them mixed up, I'm going to provide some helpful mnemonics. I'm also going to cover whether the cranial nerve is sensory, motor, or both. So make sure before we get started that you hit that like and subscribe button. Okay, welcome. We're going to be covering cranial nerves today. For a copy of this PowerPoint, make sure that you subscribe, and you can email me at nursingwithprofessorb@gmail.com. I will leave my email in the comments, but once again, it's nursingwithprofessorb@gmail.com if you want a copy of this PowerPoint. This is a great picture that helps you see what the cranial nerves do. Cranial nerve number 1 is olfactory. That's your sense of smell. Cranial nerve number 2 is your optic nerve, and this one is responsible for distant vision, and it's tested with the Snellen chart. 3, 4, and 6 are going to move your eyes. Cranial nerve 3 is your oculomotor. The artist put it up here. 3 is responsible for eye movements, pupillary constriction, and accommodation. Cranial nerve 4 is your trochlear. It's responsible for movement of the superior oblique muscle. The artist put it here, but again, it also helps with eye movement. And 5 is your trigeminal. We'll come back to 5, but remember 3, 4, and 6 help move the eye. So 6 is your abducens, and it's responsible for movement of the lateral rectus muscle of the eye. And then going back to 5, it's the trigeminal. And there is a condition that's called trigeminal neuralgia. So it supplies sensation to the face, the nasal and buccal mucosa, and the teeth. And if this person has trigeminal neuralgia, they would experience excruciating pain. 6 we covered already. That was the abducens with the lateral movement. 7 is facial, right here. Cranial nerve 7 is your facial. It innervates the facial muscles and supplies taste to the anterior 2/3 portion of the tongue. 8 is the acoustic. You see it here. And it is responsible for hearing, balance, and awareness of position. Cranial nerve 9 is the glossopharyngeal, and it supplies sensation to the pharynx, posterior 1/3 of the tongue, and tympanic membrane. Most of the time, depending on if you're an undergraduate nursing student, you primarily need to know basics of what it does, the name of the nerve, which nerve number it is, and just knowing the basics. If you're a nurse practitioner or med student or PA student, then you do need to know a little bit more in depth. Cranial nerve 10 is the vagus. It supplies parasympathetic fibers to the viscera of the chest, abdomen, motor fibers to the pharynx, larynx, sensory fibers to the ear, meninges, and viscera. And that's when we say, like, for example, when a patient is on the toilet and he's bearing down, his vagus nerve gets stimulated and he can pass out sometimes because it's associated again with the parasympathetic system. Cranial nerve 11 is the spinal accessory, and that's the one that's responsible for shrugging your shoulders. So with cranial nerve 11, I think of my shoulders as two posts here, and they make up the number 11, right? So when I shrug my shoulders, that's how you test cranial nerve 11. And I think of 1 and 1. My shoulders make up the number 11. And we test cranial nerve 11, shrug your shoulders. That's how you test it. And we can also test it by having the patient move against, you put resistance, and by having them move it, because that's the sternocleidomastoid and the trapezius is back here. So trapezius, sternocleidomastoid is around here. And then we have the 12 is stick out your tongue, blah, and that's the hypoglossal, and it supplies motor fibers to the muscles of the tongue, and it basically allows the patient to stick out his tongue. Repetition is the mother of learning. So once again, we have the olfactory, which is responsible for smell, optic vision. Here we have whether it's sensory, motor, or both. Now, this would be more for NP students, PA students, MD students, that you need to know whether the cranial nerve is sensory, motor, or both. So if you're an undergrad student, you don't need to really worry too much about this. But once again, oculomotor is responsible for most eye movement. 4, it moves the eyes. Trigeminal, face sensation, and mastication. Remember, this is why people with this nerve get pain, because it's responsible, the trigeminal is responsible for the sensation, not the expression, as in that case. 6 abducts the eye, and that you can remember that by abduct and abducens. Facial is responsible for the facial expression and taste. Vestibulocochlear is responsible for hearing balance. Glossopharyngeal, taste, gag reflex. Vagus, gag reflex, parasympathetic intervention. Accessory, shoulder shrug, hypoglossal, swallowing, and speech. This is a handy dandy way of also looking at this. And you see how over here they're grouped. 3, 4, and 6 are grouped in regards to the eyes. The trigeminal, it has the face, sinuses, and teeth. So it depends on how you like to learn. This one was a little bit too much for I like things simplified down, but maybe this one really resonates with you, and if you like it, then you can certainly use it. Now we're going to discuss some mnemonics for how to remember the cranial nerves. To be perfectly honest with you, this one didn't work for me. On old Olympus towering tops of Fan and German Butem hops. I don't know, it just doesn't stick. So there's another mnemonic. It's a little bit PG-13, but I think because it's a little vulgar and it made me laugh, it stuck with me. So if you are easily offended, stick with this one. If things that are vulgar or is what helps stick with you, then we're gonna go on to the other one. If not, skip ahead.
Okay, so here is our dirty mnemonic. It's O to touch and feel, very good vagina, heaven. So as you can see here, O for olfactory, O for optic, O for oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus for vagina, spinal accessory, here it's the A for and hypoglossal for heaven.
Next we need to cover, is it sensory, motor, or both? So as you see here, 1 and 2 are sensory, 3 and 4 is motor, both, sensory, both, motor, motor. Okay. I like mnemonics for everything because I need to have a handy dandy little way of putting it in my brain. I can't just remember things in a vacuum. So there's a mnemonic for this also, and there's different versions, but I'm going to show you the version that I selected.
The next mnemonic is to know whether the cranial nerve is sensory, motor, or both. And the saying is, some say marry money, but my brother says big brains matter most. Olfactory is sensory. Optic is sensory. Oculomotor is motor. 4 is motor. Trigeminal is both. Abducens is motor. Facial is both. Vestibulocochlear is sensory. Glossopharyngeal is both. Vagus is both. Spinal accessory is motor, and the hypoglossal is motor. And once again, if we go back here, this matches up. Sensory, sensory, motor, motor, both, sensory, both, motor, motor. Some say marry money, but my brother says big brains matter most. That brings us to our end. We've covered cranial nerves. We've covered their function. We've discussed mnemonics in order to memorize the order of the cranial nerves, and we've discussed if the cranial nerves are sensory, motor, or both, and I've provided you with a mnemonic for that as well. I hope that this helps you. Happy testing!
Thank you so much for watching. I hope that now you understand your cranial nerves and that you will remember them and not forget them.